Honorable Prime Minister of India has been monitoring our situation since the beginning of the whole, you can say, problem in India. Every cabinet meeting we had been discussing this. He had been having official review meetings, and in the days of February, he constituted a group of ministers under my leadership with the Minister of Aviation, Shipping, Home Affairs, External Affairs, etc. And since then we have had 10 meetings of the group of ministers. Our cabinet secretary has been taking regularly meetings over the last almost 3 months. We are completing next week with all the different ministries. They have been mentioned there: civil aviation, shipping, home affairs, external affairs, pharma, textile, tourism, industries, commerce and defense. We have been having regular video conferences with the health secretaries of all the states and all the relevant central ministries. Our technical joint monitoring group of experts, which met for the first time on 8th of January, has had 10 meetings since now. In the very beginning itself, I wrote to the Honorable Chief Ministers of the country and have been having regular video conferences with all the state health ministers. Almost every second, third day, I talk to every minister on the telephone. I have briefed the Parliament on 3-4 occasions about the situation in the country, and have been regularly visiting airports, quarantine facilities, hospitals, and seeing for myself along with my colleagues the implementation levels in the field. We have a very robust integrated disease surveillance system in the country, and we started this community surveillance itself very early, around the same time on 17th of January. Then preparing for the personal protection kits, N95 masks, agents also, that we started doing very early. In the initial stages, we started with 15 labs, and right now I think we have 124 government labs in the whole country and about 51 private labs with 16,000 collection centers all over the country. Starting from airport health officials and immigration officials, we trained our state and district surveillance officers through video conferences, medical. We evacuated over 2,500 people from 5-6 countries, like from China, Japan, Iran and Italy. Many of them were Indians who were stranded there, but even about 48 foreigners also we had evacuated. So we trained those medical evacuation teams for Wuhan, Yokohama, Iran, Italy, and of course the airline crew and the other handling staff. Quarantine medical teams were trained for patient management and infection prevention and control. State rapid response teams were trained for managing high risk pathogens. Then our NDMA, that's the Disaster Management Authority of the country, it convened meetings of the civil society organizations and 20 organizations, big organizations, and 300 NGOs. Then on 6th of March, we organized a national level training of trainers for specifically dedicated to all aspects of COVID-19 management. And here it was attended by 260 health professionals from states, ESI, railways, defense and other ministry. But the big thing was that at 1,000 locations in the country, people were logged in for this training, and thousands of related people, they got trained in a single day. And the focus areas were epidemiology, surveillance, laboratory support, clinical management, non-pharmaceutical interventions, infection prevention control and risk communication. Then followed by this national level training, on 9th and 11th of March we did state level trainings across the country, followed again by district level and hospital level trainings on 20th of March. And similarly there was an orientation workshop on 18th of March. and then on 21st March we have trained people in a big way on the usage of ventilators.